We're now going to be looking at the treatment protocol that I've put together for you for treating the urogenital tract in women, and we're working on the female pelvic area. Now you'll see that in this treatment protocol I've divided it up into three parts. Three parts because conceptually we're going to be working on three different systems or areas of the body somewhat. The first part is going to be where we're going to be working on the actual pelvic organs. The second part is going to be where we're going to be working on the thoracolumbar junction. And the third part is going to be where we're going to be working on the sacrum, the sacroiliac joints, and more specifically within the pelvis on the psoas muscle. Now, why have I broken them up in this way, and what is it that we're trying to accomplish? Well, remember that we said that when we're working on the pelvic organs of a woman, we're going to need to improve and restore mobility of the bladder, of the uterus. So you're going to see me demonstrating three different techniques where we're going to be working on releasing any adhesions that might be crowding the bladder, releasing any restrictions, and improving mobility. So we're going to be reducing any ptosis effect of the bladder sitting down heavy on the perineal floor, which often leads to an urinary incontinence. And we're also going to be working on releasing any adhesions that might have an effect on the uterus. Because as we saw, the uterus, if it's in a malposition, is going to very much have a bearing down and heavy weight effect on the bladder. And so the uterus and the bladder interrelate, have a reciprocal effect on each other. And so releasing and restoring mobility of both is going to be crucial. Next, in part two, when we start working on the thoracolumbar area, why are we working on that area? Well, remember we said that from a neurological standpoint, the thoracolumbar junction is the reflex center for the entire urogenital tract. So any type of facilitated segments of the spine in that area, either because there's inflammation or tension or any type of acute or chronic state, can have an effect on that area and neurologically its ability to be able to have an effect on the sphincter muscles of the uterus and also of the urethra and its interrelationship with the bladder. So releasing any problems that you're going to find within the thoracolumbar area is going to be key from a neurological standpoint to helping restore proper neurological functioning of the pelvic organs of the bladder and uterus. Lastly, we're going to be working on the sacrum, on the sacroiliac joints, and on the psoas muscles. Why? Because we said that from a vascular standpoint, from a vasoconstriction and vasodilation viewpoint, the sacral area has an effect on the reproductive organs and on the uterus, but also because we want to restore mobility in that area to improve vasodilation, but also in order from a mechanical standpoint to allow the pelvis to have the space that it needs in order to be able to function properly and in order for the organs to be able to take back their natural position. So that's why we're going to finish our technique by our protocol by stretching the psoas muscle, because as we know, when the psoas muscle is tightened and shortened, not only does it increase lumbar lordosis, but it also shortens the diameter of the pelvis. So think of it this way, what we're doing is we're trying to restore mobility of the organs, but then we want to make sure that the neurological control of the organs is intact and healthy, and that also there isn't any residual tension on the pelvis, which is causing the pelvis to be in a state of tension, thereby crowding the organs and further contributing to problems within volume pressure within the pelvis and reducing their ability to have that proper mobility and motility that we talked about at the beginning of the course, which is so important for the women's urogenital tract. So let's go ahead and let's take a look at the protocol and you'll understand exactly what I'm talking about.